All right, so this video is going to be about some research that we like to share with patients. So we always like to say that chiropractic, it's really good for pain, right? To get you out of pain. So basically, a couple research studies, which I know I've mentioned before, but one is it says the reason 50 or 60 visits, and this is from Dishman in 1988 in JMPT, a really reputable journal. And so it says the reason 50 or 60 visits are necessary over a period of many months is due to the adventitious fibrils, fibrosis, scar tissue, etc. It means that when those joints are locked up, think about this, if your joints are locked up, you may feel stiff, but also we might have showed you on your x-rays you have degeneration. That's arthritis in there. That means that there's inflammation, there's scar tissue in there. So what this is saying is to break that up can take 50 or 60 visits over a period of many months. It would seem more rational than trying to explain the necessity of replacing a bone out of place perhaps 60 times or more. And I always tell people it's like getting your spine conditioned. Okay, so that's one study. The vitamin study is another one I like to talk about, and that it talks about how you never want to wait more than 2 weeks to get adjusted because that prevents more arthritis from happening. And if you already have arthritis, we're not going to like get rid of your arthritis, but I want to prevent any more degeneration. And then this one right here, McGill, and this is from the Biomechanical Concept of Chiropractic Practice. Vitamin was 1987. The McGill study was 1999. Increased function and reduction of pain may not occur for 3 months. In other words, it takes 3 months to restore function to the motor control system. So chiropractic's great for pain, okay? Then we always say it's great for prevention. So in other words, preventing issues, or if you have an issue, coming out on the other side of that a lot faster. So it's great for prevention. And then the third thing is performance, and this is really cool right here. So here's a couple of studies on performance. So one back to, and by the way, so we have a handout sheet right here. If you've been given this one with some strengthening, and on the back of it, I like to show, usually what we do is when we're going through a care plan with someone, we're giving them stretches and exercises to do at home. That's where some of those studies are. This one right here talks about the less healthy the patient based on function, not symptoms, the more repetitions of adjustments they will need to create the synapses along the healthy pathways. In other words, it's how chiropractic adjustments affect the brain. And then another one just talking about the the stages of healing, acute inflammatory repair and remodeling stage right there. So that's on the back. So if you want that one, these we kind of have, we don't have them printed and in the office to hand out. We kind of just like, if you want a copy, we can give it to you. But this is the effect of cervical spine manipulative therapy on judo athletes on their grip strength. This is really cool. Now, you don't have to be a judo athlete to get the benefit of this. Maybe you don't do judo, but maybe you have to, you play pickleball, you play tennis. Maybe you want to be able to lift weights and the grip strength when you're grabbing the weights. Maybe you're older, you're trying to get out of a chair. I want you to think about how it applies in your life. Maybe it's like you're going to grab kids, you're trying to grab a kid. They're running away from you, or you're trying to grab them to change them. I know it's like I got to wrestle my kids to get them to change them, right? And I got young kids, so I need improved grip strength, right? But basically the results were that in the people that got their neck adjusted, let's see right here, analysis of grip strength data revealed a statistically significant increase in strength within the group that got adjusted. After the first adjustment, it was almost a 7% increase on the right and a 12.61% increase of strength on the left side. As compared with the second adjustment, there was 11.53% increase on the right and 17% on the left. And the third intervention, 10.53 on the right and 16.81 on the left. The group that didn't get adjusted, there was no change. There was no change in the grip strength. So could you imagine that? It's like your muscles get stronger, not just from working out, but from getting adjusted. Why? Because we affect the brain and the areas in the brain that control the muscular system. That's super, super key. Subclinical neck pain. That means no neck pain and the effects of cervical neck adjustments on elbow joint position sense. You know, if you have family members that are older, maybe an old uncle, an aunt, parents, think about joint position sense. Think about balance, right? So they're talking about the elbow with this study, talking about, hey, you're going to know like the position of the elbow, but what about just your overall balance? And basically what this showed was that, that it improved, basically. So helping with position sense. I just look at that as like, hey, just, people, you might have tennis elbow, you might have golfer's elbow, but maybe we're just talking about overall just sense of a joint, and think about just being able to stand under gravity and have a good sense of where you are in space. That's super important as we get older, right? Is balance. Because if you are older, you have a lot of patients that come in, we'll show them their x-rays, and you know what they'll say? They'll say, yeah, well, I'll ask them, hey, when's the last time you had a bone density, right? Oh, yeah, I did have a bone density. It showed osteopenia. It showed osteoporosis. Okay, so if you have decrease in bone density and then you have a hunched over posture, do you think that could affect your balance? Oh, yeah. Well, do you think when it's icy out or it's not icy out and there's not snow on the ground, or you just walking up the steps or coming out of your house, do you think if you're up straighter and have better balance that can help prevent falls? Think about that. The research shows, especially after 60 years old, if you fall and God forbid break a hip, what's the quality of life with those people? And you might be thinking, I'm 30 years old watching this. Listen, I used to think that way also, right? Now I'm in my 50s, so I don't bounce back like I used to. It's a work in progress. I know a lot of you are in your 40s and 50s and 60s and maybe even 70s watching this, and we have a lot of older, not old, but older people come to my workshops. They appreciate it because they're trying to work on these things, okay? So I would give you advice if you're younger, work on it now. So that's that one right there. That was really cool. Here's another, let's see what we got here. One right here that's just really cool. I'm just going to point out one more. Increase in cerebral blood flow indicated by cerebral arterial area and pixel intensity. Basically, it talked about when you get the curve in your neck improving that cervical lordosis. This study talked about how it increased blood flow to the brain. Now, that's super important. What's the main category that affects people as we get older? The main category of disease are the neurodegenerative diseases, the brain disorders like Parkinson's, Alzheimer's, and dementia. Yes, it's multifactorial. It's like, oh, what causes that? There's a lot of things that can cause it, but do you think it would be beneficial to have increased blood flow to your brain? Think about that. So getting the curve back in your neck, we know that helps with that. There are three main things that help to get your spine conditioned and get the curve in your neck. It's specific adjustments, gentle adjustments. So getting those joints in the neck moving, adjusting, you sending positive signals to the brain, gets you in that stress response. That's super important. Breaking up those adhesions, getting the spine conditioned, adjustments. It's ATE, extension traction. That's the wedge we have. We also have a standing traction unit. I haven't put a lot of people on standing traction. We don't do it right away because it's very aggressive. So if you're not doing that, that's okay. We do have wedges in the office that we put you on that. That's the pillow you lay on for your neck curve, right? To get the curve back in that direction. And then the exercises, and it's 2 exercises that help with the curve in the neck. That if you're on the vibration platform, we've given you those 2 exercises. Even if you're not on the vibration platform, you can do these 2 exercises. It's a neck extension exercise like this. You can hold 10 seconds, and then it's a chin pullback. It's really called a chin tuck, but I like to say pullback because when I say tuck, everybody does this, and I don't want you doing that. So it's like this. Okay, so you can do those 2 exercises. All right, I hope this information helps you, and I hope it makes sense. If you have any questions with this, let us know. All right, have a good day.